enabled field, making worker health a core business value, not just a compliance requirement. So occupational, the labor codes, these envelopes various aspects of individual relations and labor welfare enactments. Presently, they are made to make, before what used to happen, they used to have companies which used to come under Mines Act, Factories Act and many other acts. So for them it was very hectic and difficult to make businesses. So the core intention of making labor code is to make ease of doing business, simplify all security legislations. So the government has combined all the 29 laws into 4 labor codes. So it is important for OHPs to know provisions of the new codes, welfare measures and pro-worker benefits. Today, the core agenda of central government vision is minimum government and maximum governance. So what we have today is Inspector Raj. Matlab, we are afraid of factory inspectors because of instead of being helpful, they are being like now the labor code we make them as facilitators. Instead of inspectors, they will be called as facilitators. So currently India has around 40 crores of workers in all the sectors working. So basically we have 4 codes. The code on wages, which was passed in 2019, code on industrial relations 2020, code on social security 2020, and then we have occupational safety, health and working conditions code, which is passed in 2020. So today I will be concentrating mainly on OSH code. So the code on wages, which is 4 previous acts combined into one code called code on wages, 3 codes combined into industrial code, and 9 laws which were there before, they are combined into social security code. The OSH code, the previous acts which were there, the Factories Act, Plantation Labour Act, the Mines Act, the Working Journalist, Working Motor Transport Workers Act, BD and Cigar Workers Act, Contract Labours Act, the Sales Promotion Employees, Interstate Migrant Workmen, the Cine Workers and Cine Theatre Workers, Dock Workers, Building and Other Construction Workers Act, which were there. All the 13 laws are combined and made into single act called OSH code. So Occupational Safety and Working Code, it was to consolidate and amend the laws regulating occupational safety and health and working condition of the persons employed in an establishment. If you can observe, it is written as an establishment. It is not mentioned as factory or plantation or anything. So establishments, we will see the definition of establishment later. So the act replaces 13 old central labor laws. The bill was passed by Lok Sabha on 22nd September 2020. It was passed in Rajya Sabha on 23rd September and it was received presidential assent on 28th September. So the code, OSH code, expands definition of factory as a premise where at least 20 workers work for process with power and 40 workers for a process without power. Importantly, it is involving social security funds for unorganized workers like gig workers and platform workers. It also works, aggregators include 9 categories. All these categories are included currently in OSH code. Women, now there is a restriction on women for working in the C shift from 7 p.m. to 6 a.m. Since even in many companies they take prior permission and they do allow the women. But now it will be applicable to all the establishment. And also during COVID we saw the issue of interstate migrant workers. So the OSH code also gives special provisions for the interstate migrant workers. So the code fixes the daily work hour limit to 8 hours and also empowers women to employed in all establishment in all shift. It also allows to form a National Occupational Safety and Health Advisory Board. So contractors have to pay displacement allowance to interstate migrant workers at the time of recruitment. So these are as we follow, every one of us follow Factories Act and few of us follow Mines Act. Majorly we come under Factories Act, all the manufacturing industries. So I have made a comparison between Factories Act and OSH code. So before the First we will discuss about scope and coverage. Before, the Factories Act was applicable to factories with more than 10 members, where there is a use of power, and for more than 20 members, where there is no use of power. Now it is considered as establishment. With more than any establishment with more than 10 workers comes under OSH code. So this implicate broader applicability extends to more sectors. So sectoral focus. Before Factories Act was only for factories. Now OSH code covers, as I told, all the 13 sectors. So now it will be made integrated OH policy across sector. So number of laws before Factories Act was 1, now it is all merger of 13 central laws. This makes simplifies compliance and reduces duplication for many of the factory owners. So definition. So definition of factory was before more than, as I told before, more than 10 workers with power or without power. Now OSH code make it 20, and one thing we have to notice here is, if there is a use of power, even with less than 10 people, any number of power and any number of people, that will come under OSH code. So worker definition in Factories Act, it was very narrow definition linked to manufacturing process only. Many of the sectors were not covered. Now OSH code includes broader definition including indirect workers, brings contract and platform workers into picture. Establishment. In Factories Act, there is nothing called establishment. There was no definition of establishment. Now OSH code defines any workplace with more than 10 workers should be called as establishment. So it will cause a formal recognition of many previously unregulated units. So health examination, though we conduct health examination for all the workers in the our companies, but it is nowhere it is mentioned as mandatory in the Factories Act. It is only made mandatory for hazardous process and other processes. So in OSH code, irrespective of whether it is hazardous or not, all the annual health checkups are made mandatory. So it will cause stronger focus on the preventive medicine. So appointment letter. This is the major change that can happen, and it will improve the life of contract workers. Before, there was no required appointment required by Factories Act. Even now, many contractors pay contract workers salary through GPay and Google Pay, and they won't pay PF and all the benefits. But OSH code makes it mandatory written appointment letter even for contract workers. So the contract workers will have legal backing for employment contracts in future. So welfare facility, it was very good in Factories Act, but it is same maintained and also extended to a few more things in OSH code. So whatever extended is greater welfare mandate for establishment, scope expanded, minimum standards, and main concentrated on gender inclusivity in OSH code. Like different toilets, like separate for male, female, all. Before, occupational disease reporting was very vague and inconsistent. Each act used to tell different set of occupational notifiable diseases. Factory Act used to tell few, Mines Act used to tell other few. So now they have made clear duties to report and investigate occupational diseases. This will improve surveillance of the workplace illness. So safety committee, Factories Act, before it was optional for most units. Now it is mandatory for more than units with more than 250 workers. This will strengthen internal safety governance. So economic and psychosocial health, it was not mentioned in Factories Act. Now it is explicitly included in OSH code. This will expand OH scope beyond physical health. So legal and licensing, before it was state level and manual. Now it is centralized online and online registration and licensing. It will help faster and more transparent process. Inspector role, before it was very traditional role. Now it will be like facilitator. Like he can't be punishing. First he has to advise the factories on what changes to be needed. Then he has to regulate them. So it is now, before it was only regulatory role. Now it is changed into advisory plus regulatory role. So certifying surgeon, before it was state appointed mostly for young adolescent, and main thing of them was to certify for young adolescent workers. Now it is medical officer role extended. There is no mention of state appointed certifying surgeon. For this, OH doctor may need to fulfill statutory roles in future as per OSH code. Policy requirement, it was not mandatory, now it is made mandatory. Contract labor, it was covered under separate law, Contract Labor Act. Now it comes under OSH code and fully integrated. Single compliance regime will be there. So interstate, it was not there in any act. It is included with registration, health and safety right, better access to health care. Now a contract worker of a state can work in any state and he can still get all the benefits that he was not getting before. So gig worker, this is also newly added concept to OSH code. Legal framework still it is evolving. Women in night shift. So in Factories Act it was generally prohibited. In OSH code it is allowed with safety arrangements. Penalties were very lower and inconsistent as per Factories Act. Now higher penalties for violations and especially recurring ones encourages greater legal compliance. Inspector had strong punitive powers before, now facilitator approach aims at improvement first, then punishment. Reduces harassment fears but mandates documentation. So Factories Act, we all followed Factories Act till now, even now we are following. So what has changed from Factories Act to OSH code? So before there were multiple fragmented laws, now it is consolidated to one code, that is OSH code. Before factory only focus was there, now it is changed into multi-sector focus. Before it was manual compliance, now it is digital transparent system. Before basic health and safety was the main concern of the OHC, now it is holistic health, welfare and ergonomics. Before it was static role, now an OHP has to be dynamic, tech enabled and has to do a modern OH practice. So implication for occupational health practice will be occupational physician now expected to play a role in compliance, reporting, record keeping and even policy drafting. So mandatory health checks and reporting of occupational diseases which are notifiable diseases increases like legal liability of the doctors. Integrate with HR and legal teams is vital to pass inspections and avoid penalties. And also we have to focus more on ergonomic stress, mental health and inclusive policies for women and migrant workers. So it was propositions of IAOH in 2018 to Central Committee team. There were so few, the FMO value factory medical officer, it was not defined particularly in OSH code. So the IAOH has made its 4-page recommendations to increase the importance of FMO. So OH, occupational health as a career path. We can call it as maybe occupational health is like radiology of 1990s. I will tell you why. Will 2030 to 2025 golden era of OH. We feel so because everyone works in country, everyone is in any one or the other occupation. So more demand for the OHPs and more clinical practitioner. There are very dearth need of policymakers in health sector. So there we will come into picture. And India is industrializing rapidly, increased health awareness among all the people. India's working population was 45 crore in 2010 and it is increased to 48 crore in 2020 because of COVID it was declining. Now it is 54 crore in 2025 and it is expected to grow to 62 crores in 2030. So formalization, digitalization of human resources is happening. Regulatory drivers, OSH code, drivers like OSH code and it covers more 35 crore workers under it. So also ESG, environment, social and governance and global pressures. All these things have increased value of OHPs as a health physicians. So there is very skill gap and supply demand imbalance. I made a one calculation. If we consider at least 600 to 700 AFH pass out every year in last 30 years, they come to around 18,000 doctors, AFH doctors. So but we have around 54 crore population. So we have only one AFH doctor for 35,000 to 40,000 workers currently. So the WHO recommends one OHP per 5,000 workers. So we have occupational health as a very great future in the coming days. And I thank team AOHK and team KFIL for organizing this event. Thank you.